The health service attracted a huge range of questions, but one of the most common was brilliantly articulated by Janine Ronaldson. Janine, would you make your way to the microphone, please, and put your question to Liz Truss?
Good afternoon.
Afternoon.
I've been a registered nurse for 31 years, following 3 years training. I'm now working in the community, working on admission avoidance, but there's been an increasing amount of registered nurses vacancies in the NHS with reduced uptake of the training, and many nurses are leaving the profession due to stress, increased workload, pension changes and several years of below inflation pay awards. How will you address these issues regarding recruiting and retaining nurses, taking into consideration the diminished salary over many years?
Thank you, Janine.
Thank you, Janine, and thanks for the work you do as a nurse. It's incredibly important. What I want to do is make sure, and I talked earlier about appointing the right health secretary if I'm selected as Prime Minister to do this, but really make sure that we are empowering the front line. You know, what you're talking about, the stress and the work pressures, sometimes, or certainly I hear from nurses, sometimes comes from a feeling that there's central diktat about what people have to do, rather than people being able to use their own judgment on the ground level in the health service. So I'd want to make things work better in the health service. I'm committed to the extra funding, but I wouldn't get that out of a national insurance rise. I would get that out of general taxation. We'd still be able to pay the debt down after 3 years. I also think that funding needs to go into social care, so we're freeing up beds in the National Health Service to deal with the patients who need to be dealt with. But there's no doubt in my mind that we face a massive challenge as a country, because a huge backlog built up after COVID, and you know, what we need to do is value those frontline professionals and make sure, you know, both nurses and doctors don't feel that they have to leave the profession. And you mentioned pensions. I do want to look at those pensions because, you know, there are issues about the cut-offs which sometimes make it harder for people to stay in the profession. But what I'd also do is I would listen to people, and I make sure the health secretary is listening to people, because it seems to me that something isn't working because the money's going in, but we're not seeing the impact of that money on the front line. So I'd very much want to hear your views on that.
Go on, then.
I think. I mean, the hospitals are actually in crisis, aren't they? Because of social care, because of COVID, they're not discharging patients as they should be able to. We're trying to keep them out. We take ambulance calls and things like that to try and take on that care instead of them hitting the A&E department. But there's just lack of funding, lack of doctors, and a lot of nurses my age are retiring when they're 55, where they'd have probably stayed on a bit longer, but now the pension's changed. You're thinking...
Are you, can I just butt in across you and then Liz come in on it? But are you also conscious, doing what you do, and thank you, as Liz said to you, for what you do, of the staggering number of vacancies that there are, folk who should be working alongside you but no longer join in the numbers that they used to? Are you aware of that yourself?
Yes. It's very hard to get staff and even like people that are you know, going for jobs and things like that. There's not as many applications anymore, and you know, like band 5 nurses, they'll go into something, they'll think we're overworked, I can go and get a band 5 somewhere else. So then they move on instead of increasing and keep staying with that team.
And I think also that during COVID, a lot of people came out of retirement to help out. They came and helped with the vaccines, they came to help, and now they've gone back into retirement. So I think there is a question of how can we encourage some of those people, because we are facing a very, very difficult situation. You know, it's a one-off situation because of the backlog caused by COVID. So I'm also interested in what we can do to encourage some of those people who might have left the profession, you know, who came back to help with COVID.
Or like the doctors stay on a wee bit longer.
How could we get them to help out in a very difficult situation? Because at the moment, as you rightly say, there's just huge pressure on those who are in hospitals, those who are in GP surgeries as well.
I mean, there's